One moment of carelessness, a scar for life. Every year, tens of thousands of people suffer burns, and many cases are handled incorrectly, making the injuries more severe and even leaving permanent scars. Do you know what to do when someone gets burned to save them in time? In this video, we will explore the causes of burns, the classification of burns, and most importantly, the proper, safe, and scientific way to perform burn first aid. Part 1. Causes of burns. Burns can happen anywhere, at home, outdoors, or at work. Some common causes include thermal burns. This is the most common type, caused by contact with hot objects, boiling water, steam, fire, gasoline, or explosions. Chemical burns often occur in laboratories, factories, or when exposed to strong acids or bases, for example, household cleaning products. Electrical burns, lightning strikes. When the body is exposed to electricity or struck by lightning, injuries can be severe. The skin may appear minimally damaged, but muscles, blood vessels, nerves, and bones are affected deeply. Radiation and physical burns, including sunburn UV rays, infrared rays, X-rays, gamma rays, or nuclear radiation. Part 2. Classification of burns. Medicine classifies burns based on the severity of the injury and the depth of the wound. Burns are divided into 4 degrees. First-degree burns only affect the epidermis. The skin is red, dry, and painful, but without blisters. Usually heals within about a week without scarring. Second-degree burns. The injury may affect the epidermis and reach the deep dermis. Blisters appear, with the underlying skin pink and intense pain. Severe cases may show white pink or patchy skin and reduced pain sensation. Mild cases heal within 2 weeks with little or no scarring. Severe cases may leave contracture scars. Third-degree burns affect the full thickness of the skin. The burned area may appear white, gray, brown, or black, dry, and hard. No pain due to nerve endings being destroyed. Cannot heal on their own and require skin grafting. Fourth-degree burns extend beyond the skin into fat, muscles, and bones. Often caused by electrical injuries or prolonged fire exposure, require wide excision and sometimes amputation, life-threatening. Understanding the degree of burns helps you know when home first aid is possible and when you need to go to the hospital immediately. Part 3. How to perform burn first aid. This is the most important part. Proper first aid determines whether the burn heals quickly or leaves a permanent scar. Step 1. Eliminate the cause of the burn. Move out of the danger area immediately. If clothes catch fire, extinguish the flames. If electrical burns, turn off the power before touching the victim. If chemical burns, remove clothing and rinse continuously with clean water. Step 2. Cool the burn area.
Apply a cool compress or immerse it in cool water, 16-20 degrees Celsius, for 20 minutes.
To reduce swelling, soothe the skin, and prevent the injury from spreading. Note: do not apply ice directly to the burn, causes vasoconstriction and deeper tissue damage. Do not apply toothpaste, raw egg, medicated oil, or leaves. These can cause infection and slow healing. Step 3. Care for the burned skin. Remove jewelry, gently cut away clothing around the burn. Keep the body warm if it is cold. Do not try to remove clothing stuck to the burn. Cut around it. Do not pop blisters as this increases infection risk. Gently pat dry and cover with a clean dry gauze or cotton cloth. Step 4. Pain relief and support. Drink warm water or take pain relievers if needed. Monitor mild burns at home. When to go to the hospital immediately. Burns larger than the size of the palm. Burns on the face, neck, hands, feet, genitals, or major joints. Deep burns, white, black, painless, electrical, chemical, or inhalation burns. Burns in children or elderly people. If the burn is severe, do not attempt to treat it at home. Delays can cause infection, burn shock, or severe scarring. Burns can happen at any time, but not everyone knows how to handle them properly. Be someone who knows first aid to save lives in time. Thank you for watching. Don't forget to like, subscribe to the channel, and check out my other videos to learn more useful tips about medicine and health.